The Illinois Department of Human Services is preparing to cut back on the number of hours it pays workers who take care of people with developmental disabilities. The department says that decrease will result in 90% of people in these facilities getting less care. Our Capitol Bureau Chief Cole Hankey is live in the Capitol. Now, Cole, industry experts say this really caught them off guard.
That's right. And this reduction in hours came just after last spring when the legislature gave these workers a $2.50 per hour raise in their salaries. And that is the first significant raise that these workers had gotten in over a decade. But experts in the industry say that the money that the state is keeping from these cuts to hours actually outweighs the amount of money that they put towards this salary increase. Paul Blowbaum's brother Norman currently lives in a group home in Clinton for people with developmental disabilities. At that facility, he receives care from direct support professionals. But the state is planning on cutting the number of hours that they will pay those workers to work. And Paul is worried about how that will affect his brother's care.
To think that what supports that he and his housemates do have could be cut. What does that look like? I don't know.
Starting April 1st, the state is planning on cutting the number of hours of care it funds by nearly 9% in these homes. The plan blindsided industry experts who are already dealing with a dwindling workforce and are constantly just trying to scrape by financially.
It puts people at a tremendous deficit, puts agencies at a tremendous deficit. And it could mean people losing services.
DHS presentations show that the 9% reduction in hours will lead to 90% of people with disabilities in these homes receiving less care. Lawmakers on both sides of the aisle say that the state needs to rethink its plan.
We need to see what it's going to actually do to an actual person in his or her home, how we are jeopardizing their safety and their independence.
This has literally, in some cases, potentially life or death consequences.
In 2020, a federal court mandated the state follow a study that gave a roadmap for how the state should properly fund these services. It included a plan for investing hundreds of millions of dollars to improve them. But the state is saying that this reduction in hours is also part of the implementation of the study's findings. But industry experts that I spoke with today said they were never under the impression that the study would result in less care.
We were not offered the opportunity to ask questions or receive much feedback as to how they came up with the numbers. It was basically presented as, here it is.
Now, I reached out to the governor's office today for comment on the reduction in these hours. A spokesperson responded with a statement saying, quote, Governor Pritzker's administration has ensured almost $500 million has been invested into recommendations laid out by the court-ordered Guidehouse Developmental Disability Services Rate Study, with $270 million still in the pipeline to be implemented. And the state has committed those $475 million additional dollars to these services during Governor Pritzker's time in office. But according to that Guidehouse study that the governor's office references, that still doesn't match the threshold that the state was supposed to meet by now. Reporting in Springfield, I'm Cole Hankey, WCIA 3, your local news leader.